Every year, on April 20th, the conversation around cannabis gets louder, but rarely more informed. At LeafEase, we think this day deserves a different kind of conversation. Not about culture or controversy, but about patients, clinical evidence, and access to regulated care. Here's what you might know. Medical cannabis is legal, regulated and clinically prescribed, yet awareness remains remarkably low. Patients living with chronic pain, anxiety, treatment-resistant epilepsy, ADHD and endometriosis are making decisions, or not making them, based on incomplete information. That gap is what we're here to close. Let me be clear about what medical cannabis actually is in a regulated setting. Prescriptions are issued only by a licensed clinician following a full patient assessment and never self-prescribed. Your dosage is precisely calibrated to the condition, history and response. This is monitored and adjusted over time. Medical cannabis is dispatched from our pharmacy and is tested, certified and traceable. It's not comparable to unregulated sources. Patients are then reviewed regularly with outcomes tracked and treatment evolves with the patient. It can be appropriately considered for conditions including chronic pain, anxiety disorders, epilepsy, ADHD, PTSD, endometriosis, sleep disorders and treatment-resistant depression. This is not an alternative to medicine, this is medicine. Prescribed by clinicians, dispensed under regulation and monitored by professionals. At LeafEase, every patient goes through the same evidence-based process, beginning with a clinical consultation. This is a full assessment with a qualified clinician. Your medical history, current medications and specific conditions are discussed. If appropriate, this moves on to a personalised care plan, a tailored prescription with specific formulation, agreed delivery method and dosage is designed for you. Medical cannabis is dispensed through our regulated pharmacy where products are issued fully traceably and fully compliantly. Ongoing review then continues through follow-ups to assess response, adjust dosage and ensure your safety throughout treatment. Medical cannabis is not a new idea. It is a maturing science with a growing body of clinical evidence and patients deserve access to that evidence, clearly explained without stigma. This 420 we're committing to education because informed patients make better decisions and better decisions lead to better outcomes.
If you're a patient, a carer or a clinician wanting to understand regulated medical cannabis, start with a conversation with LeafEase.